we consistently have doctors that are not doing any sort of special techniques. They're not doing any sort of anything different, except they're using the AMC procedures.
Welcome to AMC. I'm Dr. Greg Miller. Have you ever wondered how you can create a culture of excellence your patients will notice? Today, Dr. Tara Horrall is going to dive deeper into this subject. Don't miss her suggestion on how a doctor can really impress the patient. Let's get started.
Hello. Today we'll be covering creating a culture of excellence your patients will notice. Now, there's a lot of different pieces that come with really creating a culture of excellence in your office. First of all, you have to look at your office from the outside in. You've got to think about those points of first impression with your patients. So what are those? Places like your external office appearance. Let's say you have grass growing in the cracks outside and your bushes haven't been trimmed, or that things just don't look crisp and inviting on the outside. Or let's say that you have rust on the ground right in front of the door whenever your patients walk in. Or maybe your plants are have seen better days, right? They're wilted or something of that nature. All of these things, from the very moment that that person drives up to your office, speak something to that patient. Consider this: does the outside of your office speak excellence, attention to detail, care and concern to your patients? From there, then you want to look at what the interior of your office looks like. When you walk in the door, is it warm and inviting? Or are you selling from the minute that that patient walks in the door? Let's face it, everyone wants to buy, but nobody likes to be sold. From there, then we have to look at the appearance and the first impression of your office staff. Are they giving that first impression that you're looking to accomplish? Are they dressed neatly? If it were the first time a patient had ever been there, could they really tell which one of you are the doctor and which one is the staff? So that speaks to really your attire. Doctor, are you wearing the attire that says, I'm the doctor in the office, gives that patient confidence in you before you ever speak a word? And the same thing with your staff. Does your staff have a great personality? Are they that bubbly person at the front desk? Or are they so busy with the tasks that they're doing that there's no greeting of the patient, that there's no interaction with that patient from the get-go? From there, then, we have to look at, all right, what's the office decor look like? What's the layout of the office? Does it make sense in flow and efficiency for that patient? Again, does that office speak value? Does it speak that the patient is the most important thing in that office? Or is your favorite sports team or mascot what's most important in the office? I've seen a lot of office evaluations throughout the years, a lot of videos of offices where instead of it being patient-centered, it's doctor-centered. It's decorated in a way that the doctor likes what's in there. The problem is, folks, that you're going to have people who don't like the same things that you do. And we have to be able to speak health to those people on a consistent basis. Now, this doesn't mean that you can't be you. What this does mean, though, is that we want to speak to that patient's innate as soon as they walk in the door. And we want that. We want the impression that they get to be that it's all about them. From there, then, how has your staff been trained? Has your staff been trained in a manner that your procedures flow efficiently? Do your procedures speak excellence? Does your paperwork speak excellence? Or does your paperwork look like, what insurance do you have? Is that your phone script? Can I have your insurance, please? Insurance information, please? Why do we not want to do that? Well, the fact is, folks, that puts the insurance as your number one instead of the patients as your number one. And we always want to make sure, again, that we're putting that patient first. Now we have to look at the doctor's procedures. Once we've gotten past the office evaluation on the inside and the outside, we've walked through the office with new patient eyes, so we know, do we look like we're too busy? Do we have everything cleaned up, right? Is our layout and our decor proper? Does it speak excellence? Is our staff speaking excellence, right? Are they trained with excellence? Do they know how to confidently answer those questions? Is our attire speaking excellence in the office? Then we have to look at what our procedures as a doctor are. Do those speak excellence to your patients? Do you have patients leaving consistently and saying, wow, you really are thorough? Because I can tell you, with AMC and the procedures that we have, we consistently have doctors that are not doing any sort of special techniques. They're not doing any sort of anything different, except they're using the AMC procedures. They change that one thing, and their patients feel like they're really thorough, more thorough than ever. And generally, the doctor's spending less time in that interaction than what they were before. So do your office procedures offer that same sort of special, that same sort of thoroughness to your patients that maybe some of these doctors weren't doing before that you could improve upon? And then what's your intent with the patient, right? What's your staff's intent with that patient every time? Again, is it our intent that every minute with that patient be health focused, that it be patient focused? Or let's face it, I've been in this situation before where it was easier to talk about me and what I had going on. Is it your intent when you walk in that door to really make that patient the focus and their health the number one focus in that visit that day? So the fact is, details matter, right? And if you master these details in practice, you will create that culture of excellence that your patients will notice. Thanks for joining us.
If this has been helpful, like and subscribe to be notified whenever new videos come out. As always, we're here to help. Text us any questions you have at 904-966-4996. AMC is your guide to becoming respected, effective, and valued in practice. See you next week.